Good morning, everybody. It's morning here still in Los Angeles. We have been busy filming all morning here in the studio. So what you see in the back here is our little simulation room where we've been filming a lot of neurologic rehab, actually. That's the focus. One of the biggest focuses of this year is filming neurologic rehabilitation, and not only for PT, but interprofessionally. So I'll give you a glimpse of what I mean when I show you that. And also we're filming, I think it was just a couple weeks ago, we had a torticollis, a young child with torticollis coming in. We did an evaluation, we filmed it. We filmed a number of different assessments, and we are working with publishers and authors to create learning experiences for our students so that you can do the entire P-body or the entire bot too with your students in the classroom, right? Which minimizes the impact of being able to bring patients in for patient day, things like that. So I'll give little glimpses of that for you in a second. And today, actually, Mary Hudson McKinney, Dr. Mary Hudson McKinney, my colleague at Azusa Pacific University, will be sharing some really cool things that she's doing with the PhysioU Apps and some of the things that we've been filming. And then also towards the end, Dr. Sarah Kraft, I'm hoping will be able to join us to share a little bit about how she uses her app in her classroom. So I'm excited that all of you are here. And just to let you know, I am recording this so that for those faculty who aren't able to join, that they'll be able to see this and learn about how to potentially use these apps in their classroom. So let me move forward here. So just briefly, I want to introduce myself. I've been teaching at Azusa Pacific University for the last 18 years. I'm a teaching and learning fellow at the university and spent my post-professional training at Kaiser in an orthopedic residency and manual therapy fellowship. I also teach for the USC Spine Fellowship using these apps as guideline implementation tools. And we've been dreaming and thinking about how to solve academic learning issues for the last 8 years. We've been building apps well before the pandemic and experimenting with how do we help students learn techniques, how do we help them integrate these testing techniques, exercises, how do they integrate that all together? And you'll see a lot of that philosophy beginning to show up in a lot of these neuro-based apps that we've created. And then lastly, I chair the institutional review board at our university. Plenty of things to keep me busy, but I'll tell you that teaching is my first passion. It is seeing the light bulbs going off in the students as we're teaching is what keeps me going and why we've built PhysioU. I want to actually briefly just introduce several of the authors of the apps, just so that you can recognize the amazing work and innovation that they've brought. This is one of my best friends. She recently passed away. She was a colleague of mine at Azusa Pacific. She was a mentor of mine during my residency and fellowship. And there was never an idea that she wasn't up for. So Dr. Catherine Kumagai Shimamura, a wonderful friend, many of you may know her, also an author of the Concussion Clinical Practice Guidelines, unique, an OCS, NCS, highly acclaimed mentor in the Southern California area. She was a big part of some of the early apps that we had created. So the NeuroExam App. This is Rachel Tabak-Tran. Some of you might know her. Did her training at Rancho Los Amigos through the USC Neurologic residency program. Was a mentor at the neuro residency at Casa Colina, very near our university. Academy of Neurology Early Career Award recipient, and now the director of oncology residency at City of Hope. So she was in all the videos of NeuroExam App. You'll see her. Many of you already know her. This is another one of my colleagues, Dr. Mary Hudson McKinney. Brilliant, amazing professor. And we are spending lots of time together this year, filming neurologic rehabilitation. And it's really been a thrill to work with her. You'll get to hear a lot from her shortly. This is Dr. Sarah Kraft. She won the Excellence in Neurological Education Award in 2013. When I first saw what she had created for her students, I said, you know what, there are many schools that could benefit from that. And so we worked together with MUSC to bring you the Rehabilitation app, which will continue to be refined. We're building a lot of cool stuff on top of that. Pediatric interventions. We're working with an interprofessional team, which is commonly how it's done. So we have a occupational therapist, professor, PhD, Jana Fischbach, as well as a number of her colleagues, PT and speech pathologists, and we are filming. We're filming how do you do interventions for common impairments, for pediatrics, for PT, for OT, and for speech. So this is really exciting for us to have her on our team. This is Dr. Charlotte Chateau from Augusta University, and she's amazing. She has a vision for how neuroanatomy should be taught, and we are building it, and it's going to be so cool. So many of these things are coming together. When the neuroanatomy app gets closer to fruition, I will do another webinar to share with you guys the vision and how it will change forever how we teach neuroanatomy. So it's a really cool 3-dimensional, very focused on student learning, and also tied to real patient videos to help students understand when lesions occur in different parts of the brain or the spinal cord, what do patients look like? That is part of the reason why we're filming so many patients, because there's nothing like really seeing how movement changes with these different lesions. And then lastly, Dr. Melissa Cole, she teaches pediatrics. We spent a whole year together filming a baby, following that baby's development for every month of his life, first year of life. And so I'll show you glimpses of how we are actually using that in the classroom as well. Just as a note, PhysioU is partnered with JOSPT. We have a strategic partnership related to guideline implementation. We believe that techniques and tests in journals should no longer be static pictures. And PhysioU is going to support that effort to help with research implementation into real clinical practice. All right, on to the main meat of the matter here. 4 ways to use the PhysioU apps in your online classroom, particularly in the neurologic setting. So the first thing I was going to do is I was going to let Mary tell you a little bit about what she's doing. She's doing this right now. The stuff she told me last night, she's doing it right now. She's going to share a little bit about how she's using these apps in her classroom. So there's Mary.
Okay, so if you go into the PhysioU app, what you're going to see is in the NeuroExam is a variety of different areas. And one of the areas that I love is the balance area. And so we'll look at doing a variety of these tests through the semester. And so there's a huge amount of standardized balance tests. And I've tried it in a variety of different ways. I have taken all the balance and just done all balance all the time. And then what I found there is students really lacked an understanding of when to use which test when for the specific diagnoses. So I changed it up a little bit. And let me know if you can see this. And so what I did is I subdivided it out. And so the very second week of my class, I have a lab handout where I'm looking at the simpler aspects of the balance test. And so this is the general balance grades: Romberg, sharpened Romberg, 5 times sit to stand, functional reach, multi-directional reach, and then single leg stance. And so all in this one lab, we're having the students look at these very, very simple balance tests. And so I've got the goals of what I want to accomplish, how they're going to be doing it. And then I basically have set up a sheet where they're basically going to be describing back to me how they complete these different tests. What are the positions that you perform the Romberg, and how many seconds do you do it? What about the Sharpen-Romberg? What about the 5 times sit to stand? What are the cutoff scores that would indicate a person that's a fall risk? What are the implications of results with a functional reach? And these are all on the PhysioU app that your student can go ahead and access. So it's something that they're actually doing on their own, and you're giving them an ability to have a little bit of autonomy in terms of generating this information. And then in the multi-directional reach, what's the average normative value? And I pick out, there's a table that's in there, mean age of 74. What would you expect at these different reaching capabilities? And then in single limb stand, with these age brackets, what would you expect eyes open? What would you expect eyes closed? So they really get an appreciation not only of how to do the test, but how to interpret the information relevant to their patient. And that's huge. That's the step that we want to take our patients to. So this is the second week of my class that they're taking a bite out of the apple with all these different balance measures.
So Mary, would you just pull up one of those tests, like single limb stance?
Okay.
And so they would actually go into one of these, click on it, view the test, and then down at the
bottom is normative data.
Wow.
So down at the bottom, they can go ahead and look at how they can apply that information. It's all embedded on that link.
Got it.
And so it really is, it's making them not only learn it at a cognitive level, but it's getting them to learn it at an interpretive level. So you're looking at a higher Bloom's taxonomy. And what you're wanting them to do when you get them to the point where you're doing lab practical exams, or that they're stepping out into the clinic, or that they're taking the state boards. It's really preparing them for that type of a situation.
So what I really appreciate about that is what you've done is you've invited them into the resource, and the worksheet creates context. So as they walk themselves through these different tests, you've given them key things to look out for. Tell me about how the test is performed. So they look through the app, they fill it in the worksheet. Tell me how you would interpret this test. They look through the app. And so you're turning what could just be a blind wandering through the app into a very context-rich experience that not only unlocks the value of the content within the app, but creates context so that the students can better apply it, better interpret it, and then transition into the clinic, which I think is one of the big issues we all face. Is we keep teaching all of these techniques in the absence of context. And then we wonder why they're having such a hard time applying it when they finally get out into the clinic. So I think that's great.
Mm-hmm. And then I also sync it to your exam questions could come from not only the lecture material that I lecture on, but maybe the lab handouts are open fodder as well. And so that makes them really kind of recognize that they're developing a study tool for when they prepare for their midterm exams. And so it ends up being kind of a rich experience for the students, I think, at least I think so.
Yeah, that's great. So they go through that worksheet in the second week of class, partly as a way to learn about balance. It's an intro to balance, but also as a way to explore the resource. And I know in a bit you're going to talk about how you integrate that into the virtual patient days as well. I mean, this is a stepping stone. It's not just here's all the balance tests and then boom, you're into the virtual patient day. It's actually a bridge towards the patient day.
Right, it's scaffolding the student's learning experience. So, my expectation early on is I teach the easier balance measures. And then as the semester goes on, so for example, this is the handout that I might have developed for, I think this is yes. So this is the vestibular week that we do. And so this is looking at the vestibular concerns A piece of the vestibular concerns is knowing how to do the ocular testing, as well as balance testing. And so a lot of these measures are again on PhysioU. And so I'll have link backs to the PhysioU app so they can explore or review how to do an oculomotor exam, how to do a vestibular exam, and then understanding how to complete this. And then I basically link it to, you know, the neuroanatomy.
Yeah.
Signs and symptoms.
Could you click on that link real quick?
Yeah.
So basically you're linking some of your lecture content and the pathoanatomy and the anatomy, and then directly into the testing procedures that they will review and that they'll learn to do on each other in lab.
That's right. And so it just links right to the area that they need to do, and they can go ahead and examine each of these different aspects, and then further explore the content. So this takes them through a series of questions, and then this is looking now at the balance component. So in the PhysioU videos, some of the balance tests that I have the students learn would be the functional gait assessment, the dynamic gait assessment, the modified CAT-SIB, even the Berg. But the Berg is more the others,
right,
for the vestibular. So if you link into this then takes you right to the balance link, and you can go on in. And there's the modified CAT, so there's the DGI, there's the FGA. So they can link right back to the PhysioU app and be able to explore these, and then practice them with their lab partners and get a better understanding of these different components.
That's awesome. That's awesome.
And then I do, it's a hot topic right now. Yeah. But I do teach the neurofacilitation, the neurointervention.
Yes.
So I do labs on NDT, PNF. I do a one-day lab on RUDE. And so what I love now is I've been linking to when I do the PNF, I do 3 days of PNF. I link to the techniques, the patterns, the functional implications of it. And then there's a wonderful case study here of a person with Parkinson's disease. And one of so my homework assignments that I give the students are synced to what the lecture and the lab information. And so my PNF week, the end of that week, they look at a patient case that's basically this patient case here. And they're to come up with intervention strategies using PNF to go ahead and explore modifying and improving his balance and mobility concerns. And so the case is absolutely wonderful in here, and you can utilize this as kind of an idea.
That's great. So this is just a short glimpse of the PNF app as well as the NeuroExam app, and how Mary has been using it partly as a lab manual. But I think what she's done even better than just using it as a lab manual is she has, James, I'll get to you in 1 second, is that she basically has created interactive worksheets that help the students as they are guided through the app to then pre-expose them to many of the tests and measures, a lot of the treatments, and even using these case studies as ways for students to see how all this comes together. James, do you have a comment?
Yeah, well, there's a question regarding the examples of worksheets that Mary was alluding to in her presentation. And I bet you that's in faculty resources if it's there. And also Mary Stout chimed in that she's doing some stuff. And Mary, you may want to unmute and share what you're doing and how you're using PhysioU to augment what you're doing.
Yes, Mary?
Can you hear me? Yes, this is Mary. Hi.
Hi.
This is our second year of using PhysioU, and we are a PT assistant program out east. And we saw it and began to use it during, of course, our COVID isolation last spring. And it worked out so well. And I'm just going to get off a tangent very quickly. Well, it was like fabulous for our physical agents and those other courses during that semester. But in neuro, what we've done with it, as we do with all of them, is we use PhysioU. We create stations in the lab. So the students rotate through stations, and why we did that was we have a 22 student cohort, and we wanted to make sure that every student practiced, or at least got an opportunity to practice every skill in lab. And then later on, it was theirs. So that's why we created the stations, and there are so many minutes to each station, and they rotate around in smaller groups. We might create like maybe 2 stations that are direct PhysioU content. And then there might be another station where, okay, I did this on PhysioU, which I won't give them too much. I kind of split it up. They'll move to another station where they actually then do some hands-on after they've done some problem solving and answering questions. And then after we do that, they might move to another PhysioU. And then at the very end, they'll have a case or 2 that they have to apply everything they did in lab and then submit that to a Dropbox. So that's how we're using the PhysioU.
That's great. That's great, Mary. When you say that they move to a station that's PhysioU, could you describe better what that station looks like?
Yes. So within our lab, we're very fortunate. We have a huge lab. So we have signs, and we block off sections of the lab into maybe 4 or 5 different stations. So if we have a cohort of 22, we might have 4 stations, and so many students are assigned to each station. And then they will stay at that station for maybe 15 minutes working on the content. And then when the time is up, we ring the bell and they all rotate to the next station. And they all have their computers with them or their phones. So they, we do a lot of electronic in our program. So they use that on the PhysioU, and they have specific questions to answer, just like Mary had on the worksheet. Yep.
And then the questions they can use the PhysioU app to look at the techniques that they're supposed to practice at that station.
That is correct. And at times I also use the PhysioU during my lecture to just enhance I use a lot of videos. So if I have time, I will also add PhysioU videos into that to enhance what my explanations are in the lecture, so that they've seen that and then they repeat it again, because we all know repetition is learning. So they do it again in lab, and then they have to problem solve, and then they eventually apply it to a real case scenario at the end.
That's perfect. That's fantastic. I think it's so important, that concept of the moment that you're done helping them develop the skill sets, the tools, that there's the context available for them to now apply it, right? You're building houses with them instead of just saying, here's all the tools. You'll learn to build houses when you get out into the clinic.
Right. And at least it gives them an exposure, that initial exposure, which we all know we never have enough time, as when you're those passionate instructors, which I'm sure everyone here is. That's why we're all here today.
Absolutely.
And it's like you don't have enough time. So you try and give them a glimpse of something that is the most common in the clinic, so they have an idea.
Yep. That's great. Thank you so much, Mary. That's fantastic.
You're welcome. Thank you.
James?
Can you hear me? Wait, let me, okay, good. Yeah, worksheets, I know you have worksheets with the ortho one. Is there worksheets for neuro that Mary's put together?
Mary,
faculty resources?
We're going to be sharing those pretty soon. Mary's
Okay.
actually building them as we speak. And so, yes, those worksheets will be available, and we're going to actually hyperlink a lot of them, which is you can see she's begun to hyperlink a lot of them. Every single technique in my orthopedic labs are all hyperlinked to videos so that students can pre-watch them before they even come to class, which is
So if you go into
so that's what this number 2 point, which was one of the simplest ways to use PhysioU, is to embed video links into your lectures and into your lab handouts. So what you see is your typical neuro lab. This is the balance lab. And so I'm just going to talk you through this real quick. If you have a lab handout that has your typical techniques that you teach, if you go to PhysioU, if you go to the main website, okay, and you go to Educator, Faculty Resources, there is a master video cheat sheet. This master video cheat sheet allows you to, so this is all the orthopedic techniques, over 2,500 techniques here, or if you go to NeuroExam, you can say, I need Berg. And here you have all of your Romberg and your Berg balance test. All of these can now be hyperlinked. You just copy and paste these links into your lab handout. The students now are able to preview lab before they even come to class. Or you hyperlink all of these techniques into your worksheets, and the students automatically have resources to auto learn on their own. So I think a lot these days, I think a lot about how important it is for pre-exposure, for graded exposure to many of these tests and techniques. When they come to lab with us, that time is very precious. It should not be the first and last time that they're exposed to these techniques. The students feel a great deal less anxiety when they have been pre-exposed, when they know those videos are on their phone or on their laptop, and that this resource follows them all the way through the clinic into their first year of practice. So this is the master video cheat sheet will come in very handy for most of you faculty, even at its simplest form, which is when I teach PNF and I have a lecture, I would love to be able to demonstrate some of those techniques easily without having to turn on my phone, turn on Zoom, adjust the camera. You can just go straight to the PNF app and add it right in. So all of the apps are all here. That is, let me go back to my PowerPoint here. How you can add videos to your lectures as well as your lab handouts. This is something that we've been doing a lot at APU. I think it has been very effective. The students get their lab handouts and know that before they come to lab, they have a job to do. And that is to go through the lab handout and preview the techniques on their own first. Then we ask them to self-practice on somebody else. I mean, most of these techniques are very simple, or at least go through mental imagery, think about how you would do the technique. When we get to lab, now luckily we've been able to go back to lab since fall, we demonstrate all of these techniques again, and half of the time we use the PhysioU videos because all the students are separated into different pods anyway. There are certain techniques that I always do in real time, in real life, and I have my camera set up to zoom in. There's a number of techniques that I just reuse my PhysioU videos because the view and the instruction is plenty good enough. In fact, probably better than what I could do just off the cuff. So that's another way that PhysioU makes my life easier as an instructor, is I always have the backup of the videos. I can just log in right away, go straight into my app, pull it up on the screen share, and show techniques. The beauty of having those techniques linked to your lab handout is I just put the lab handout on the screen share. We are going through each technique. The ones that I'm demonstrating live, we have my camera that's zoomed into the same meeting. And the ones that I don't want to demonstrate live, I just click on that link in my lab handout and boom, PhysioU shows up and demonstrates the technique. The last thing I would say that has been very useful for us is the virtual checkoffs. So the students are being held accountable to these skill sets by doing virtual checkoffs with TAs. They're doing them on tables, on couches. They're doing it however they can and are being asked to demonstrate key techniques because the amount of practice time that is in the classroom has been severely limited. So I think this is a reasonable way of holding them accountable to practicing these techniques. Here's seeing the big picture. This is kind of exciting stuff. I'm going to let Mary tell you what she did last week. I was just talking to some of the students who have experienced what she's teaching right now. I'm going to let her share what she's been doing, and I'll show you some content that we have captured.
Okay, so what we did is we took a look at three different cases. So normally I like to pull a variety of different neurologic patients in and the students get a chance to do an evaluation and intervention. And it just wasn't possible. And so what we ended up doing is taking a look at basically Roy Trujillo, the same gentleman that you saw with the PNF piece, came on in and we filmed him doing a variety of different activities. These are all the different folders that you see. I'm going to click on subjective and you'll see a tiny bit of the subjective, and it's just as an example, and then I'm going to show you some of the forms that I filled out. And the students basically got to fill out a NeuroExam as they were watching the patient go through a variety of clips. Okay, all right. So welcome to physical therapy. My name is Mary and I'm going to be your physical therapist. So tell me, what brings you into physical therapy?
Well, I want to try and stay active. Sitting there watching TV is not a good thing to do. From everything I've heard regarding people with Parkinson's, being active, exercise is just as important as taking medicine.
Oh, I totally agree. So now your doctor mentioned something about a fall?
Oh, yes. I had a fall a while back. I was walking my dog, small dog, about 15 pounds. Just got about a block away from home, and just out of nowhere, a big dog, 70, 80 pounds, coming around this big bush.
Oh my gosh.
My small little dog, and started to shake it. And so in the meantime, I started to kick this big dog 4 or 5 times, and my shoe flew off. And I fell in the street on the pavement, hit my knee. And
okay, so there's a little bit of a mark here, all right, and a little bit of black and blue, so it's resolving a bit. Okay, so it goes on and on. So so each of the different video clips will have different amounts. So we looked at filming 3 different cases that I thought would be helpful for my students. One was a person with Parkinson's. The second was an incomplete Asia D spinal cord injured person. And then the third was a traumatic brain injured individual that was in a coma for a period of time post their traumatic brain injury, so more of a severe condition. So this is penciled in. I do apologize that it's penciled.
Nope, that's perfect. That's great.
But I basically wrote down, so this was going to be, I have 2.5 hours to complete the evaluation or the experience for the students. And so I wanted to go ahead and provide the students a chance to take notes. I gave them a blank NeuroExam, and you'll see the NeuroExam in a second, and a blank piece of paper that they could take notes on and then transfer over the information that they had derived. And so I basically came up with a series of things that I wanted to show them. And so it went from subjective to doing vitals and supine, sitting and then immediate standing, to mobility, to looking at range and reflexes and rigidity, to looking at reactive balance, to looking at 10-minute walk test, 10-meter walk test, the tug, a MOCA screen, and then the functional gait assessment. And then I filmed some interventions as well. So LSVT interventions, some power interventions. And so so what I did is I had a key that I developed.
The little plus, yep.
Okay, so hopefully you guys can see this.
Yep.
So again, I apologize, it's handwritten. But I'm having the individuals fill out then this information so that they can kind of begin to kick the tires on what filling out documentation would be. This could be a paper and pencil less often in the clinic, more electronic. But at least this gave them an experience of the components that would be entailed on that history. So what their current medical history is, chief complaints, past medical history, family diagnostic tests, and current medications. And then what is their prior, their current level of function, and then patient and family goals. And then from there, I also talk about their home environment. We list the vitals. We look at pain. We look at eggs and eases. We look at the MoCA and where they're at in terms of orientation and cognitive capability. And then I didn't really test these on the film or on the videotapes, but I gave them this information as if it had been collected.
Perfect.
And then sensory testing. What would I perhaps see in a person with Parkinson's disease? And then no, I wouldn't do spasticity. Yes, I would look at rigidity and bradykinesia. And what would I see reflex-wise? Cranial nerve testing? Not really. However, you see a decrease in olfaction.
Let me ask you real quick. So the students also had a blank sheet just like this, and you were watching little clips, and then they were filling it out as though they were doing the evaluation.
Exactly. So I would take them to, okay, we're going to fill out the FGA. And I gave them on Blackboard here. I go here, give me a second. Here's the MoCA. Here's the freeze of gait. Here's the FTA. So they had a blank FTA. And so I was showing them the different flips of the FTA, and then they were scoring the different flips. And then we would discuss what they came up with, and is what we did. Ready, set, go. Fast, slow. Okay, very good. And
so little videos like that, and then what would you do?
Score. And then we would pause it, give them a chance to score it. Okay, now what you're going to do is you're going to carry this cup of water at the same time that you're doing that task, and try not to lose any of the water. All right, so here you go. Okay, get ready. Ready, set.
So do the alphabet thing?
No. Just carry the water.
Okay.
Okay, ready, set, go. So you see a little bit of impulsivity, but a good sense of humor.
That's right. So it really gives about as close as you can get to being in the room doing the evaluation with the patient. And I think.
Okay, so what we.
So what I would just say about that is, we have all these videos already edited into little chunks that we are going to put into an app format along with the worksheets, so that faculty will be able to utilize these as virtual patient days, where students can score the tug, they can score the FGA, they can listen to the subjective exam. They can even see the interventions that Mary chose to do. All of those can be clinical reasoning development experiences. Let me just keep going a little bit further here, and then we'll open it up. I think if Sarah, I don't know if you've joined us yet, but I've saved you for last.
Yeah, I'm here.
Oh, fantastic. Okay. So here for developmental milestones, I just want to show you real quick. Let me go to the app. So in the app itself, when you log in, you'll see that what we filmed for developmental milestones was a number of things. One, besides the first month, the month 0, which we missed this baby, we followed baby Blake. Baby Blake, we followed him for every month, the first 12 months, month 1 through 12. So you get to watch as baby Blake develops, sitting, pull to sit, and how he changes over time. So here are some observations, some atypical development. Now all of these videos are at your fingertips. You can refer to them, find them anytime you want. This also includes reflexes, all the common reflexes. And to help with interaction with the students, we have created standardized testing. Now for the standardized testing, what we've done is we've organized the tests and measures in one place by diagnosis or age. So here are the test and measures. Now, of course, most of these are proprietary. So we've put some basic information that's freely available on the web. We've directed people to the SRA lab. And we also have directed them to the instrument should they need to purchase it. So we've tried to at least organize that and make it cleaner and simpler. The other thing that we've done is we've created little case studies. So with the case studies, just little sections, right? We just filmed little sections that a instructor, so again, there's a link to the instrument for the patient, for the student to buy or the clinician to buy. And we asked the student to just practice. Okay, here are these different items. Please score them by watching the video. So this is what they do in class. And then boom, there is the key. And so some discussion can be had here. We are now working with the publishers as well as with the authors of these tools. For example, Ken Petetti and I were on a great conversation about Bot 2 and how we have filmed the entire Bot 2, fine motor and gross motor. We filmed the entire P-body being done on children so that your students would be able to now learn how to use the tool properly so that they would better be able to use the tool when they're actually out in the clinic. So we are in conversations with many of the authors and many of the publishers to make that happen and make it easier for you to teach. So that's a little bit about the developmental milestones. We are bringing in more children and filming more children doing various different tasks that you can utilize as a way to help the students determine whether typical or atypical development is occurring. So there's observation, all of the answers are hidden, functional age, actual age, diagnosis, short-term and long-term goals. These are all tools for you as faculty. Again, all at your fingertips, however you choose to use it in your classroom. This part here, let me go back to here. One more. Got, wow, how many do I have open? A lot. Okay. Yes, here. So the other thing that I was just going to mention before I hand it over to Sarah to share a little bit about how she's been using her app or any of the apps in her classroom is we collaborated with the University of Idaho to create a pediatric gait virtual reality tool. So now your students can go in, choose an 8-year-old child with hemiplegia on the right, and use the Edinburgh Visual Gait Score, which we have permission to use. Again, many of these authors love the idea that students are learning to use these tools in unique and interesting ways. And so you can put a goniometer on, you could put a posture grid on, you could slow the patient down, and they go through and click step by step on the Edinburgh Visual Gait Score, and then they can compare their score at the end. So they're learning in this virtual environment how to do gait analysis on this pediatric population. So there's, I think, 3 or 4 different patients in here. So that's another fun thing that our pediatrics instructor is using in her classroom. Just as a heads up, we are, as part of my effort this year of filming lots of neurologic patients with neurologic issues, we're filming a whole list of movements and tasks that you will be able to utilize for your movement analysis or task analysis. So again, here's Andrew having fun.
Full Monty, take 1.
And so we, part of our job this year is to capture all the common movements in a number of different patients with different neurologic conditions, so that you have a whole collection of donning and doffing of clothing, of getting in and out of bed, sit to stand, rolling, all of that will be released in the Movement Analysis Task Analysis app. It's going to be a fabulous tool for I think, for faculty. And here we're with Sarah talking about her Neurologic Rehab app. You know, when I saw what Sarah had created, I thought, yes, there are faculty who are doing cool, innovative things. We have to be able to share this with colleagues and other students all over the country. And so, Sarah, I don't know if let me make you co-host for a sec. If you don't mind sharing a little bit about how you've been using PhysioU as well as your app, so that faculty can actually figure out how to use the apps, you know, hearing from the author. So Sarah, I'm going to make you a co-host here.
Thanks. So I use a lot of the things, and I can share screen and just show you what I created that now is in the PhysioU app. And I don't know if you got my message in the chat, but I got my first articulate case study done, so I can at least show you a little bit about how that's going to look. I don't know if that's something you want me to do.
Yep.
So I use on my app itself, it's got a video library. I use the video library a ton, and it's kind of broken up into 3 different categories: evaluations, case studies, interventions. So the evaluation is just one young woman with a stroke, and it goes through a full evaluation, and there's quizzes attached to it that my students go through to just check themselves to see if they're on the right track. The case studies, if I click on there, they're different just videos of patients. And these are not as structured, although I have them structured, but on this, this is something I'm working on with Mike to get more structure for faculty, but it's basically watching patients move. So if I were to have this gentleman walk, I have my students kind of try to see what they think is abnormal about his gait, and then hypothesize what they would want to go and evaluate on this patient. And then we talk about what they would prioritize in an evaluation based on the observational movement they saw. So this gentleman, and they don't have volume because these were all taken in a clinic setting, and so it was really loud in there.
Foot while he walks.
But it goes through his sit to stand, and there's lots of things to see, and then it goes through him walking on in this case a cardiac walker. But I have several patients with different impairments that they watch. So I use that to just kind of talk about, okay, what would you want to go and evaluate? And then I give them some evaluation data, and then I ask them, okay, now how are we going to treat this gentleman? So we take it all the way full circle with those case studies. So that's how oops, I did not mean to stop sharing.
Actually, do you mind actually showing the eval part and how you get your students to go through the eval, go through the quiz, so that they self-learn on their own at the beginning of your class?
Yep. So on the eval is kind of broken up into different categories. So for example, the history, it actually has me interviewing a patient, and then there's a quiz here. And so they take the quiz after they hear it, and it asks them based on their history, the reasons for not returning work, what testing would be performed to just get a baseline assessment. So what would we do? And then let's say they pick the Berg balance test. It gives them some feedback on whether that was the right or wrong choice and why, which I think is really important so they can learn from that. And then when they get to the right one, it allows them to move on to the next question. So she reported getting very fatigued, and endurance was a big problem. So the 6-minute walk might be what we want to capture. And there's quizzes for all of the pieces in the evaluation.
Now, how do you use the in the neuromuscular video library? How do you use interventions in your class?
So the interventions is broken up into just different categories, and so we learn. So all of these they have to watch the videos before they come to class, and so they're familiar with them. And then when we get in class, we practice them, and then I apply them to case studies. So some of the case studies are some of the video case studies, and some of them are just written case studies if I don't have a video that would relate to that particular intervention. So that's kind of how I do it. And it's for different, there's gait, there's transitional movements, there's transfers, et cetera, all the different things that we might be doing. So that's how I use the intervention library. And there's a lot of videos in there.
Yeah.
What else do you want me to show you in this one, Mike?
I think it would be kind of cool to see what you're doing with the articulate case.
Okay, so the articulate case is something that I just got it today, actually. So this is taking one of those videos of the case study. Can you see my screen pretty well?
Yep. If you could maximize it so it can fill the whole screen.
Yeah, let me just do that. Hold on just a know if I can make it bigger.
That's good. That's good.
Okay.
Or the green dot at the upper left.
Green dot at the upper, oh yeah, here it is. Okay. So this, there we go. So this is a patient video. So first they watch a video of this, my patient here who's had a stroke. And they watch it, and then they go to the history questions. So I give them a little bit more history, written history about what her status is. And then they get into some clinical history questions. So they go into the questions based on the history. What body structures would you want to test that's impacting her long distances? And again, they have the cardiovascular, they give them some feedback into whether that's right or wrong or why. And it goes through the medications that she's on, transfers. So we have a video of transfers, what they want evaluation, what they think is causing perhaps her difficulty coming to stand. There's a gait analysis video, some questions about gait, and it just keeps on going all the way through. All the way through a stroke impact scale. So it just, every time there's more information, they get more questions based on either the video or, for example, for the stroke impact scale, I actually give them the scores of her stroke impact scale. So these were the scores, and then they have some questions based around that scale in terms of what does this mean? Some interpretation questions. So that, in my mind, they would do this all prior to coming in, and then they would be tasked with going to the evidence then and coming up with a treatment plan for this patient, and they would bring that to the class so that we could discuss it as a group on what they would do intervention wise.
That's great. James seems to have go ahead, James.
Well, a question specific for Sarah, and it sounds like, Sarah, you spent some time getting oriented to the PhysioU app. What would be your recommendation for someone who just started using it? It could seem overwhelming where to go find this video or that thing and stuff. How did you grow up with PhysioU and start it and develop it into now? And how fast can a brand new person expect to kind of get up to speed?
So I'm kind of a tinkerer. So I like to just tinker around and see what I see. So when I started using PhysioU, like, of course, I'm really interested in neurological rehabilitation. So I went straight there. That's where I went. And I literally just went through it all and said, okay, what can I use for my class? What is going to help me? And I found a lot of videos that would help. All the balance videos in there are just great. All those outcome measure videos. And so we were able to really easily incorporate them into when they were learning, for example, the Berg balance test or the DGI or the FGA or any of them. We were able to have them have videos to see how to. So we would have them, I usually use it as a preamble to coming to class. So you watch this video first so you're familiar, so that when you come to class, we can dig deeper and learn more about the interpretation, because administering the test is something that I think is easier than, okay, so now what do I do with this information about this test? And what does it mean to me as a therapist? So that's kind of how I got into there and just really started looking at all the videos and was super impressed. I think it was a reach out to Mike really quickly and say, oh my God, I love your content. I want access.
Yeah. The thing that worked for me, and I'm very different in the sense that I'm more the ortho sports guy, and so the Gait app that PhysioU put together was a godsend for me when I'd find some videos on YouTube, and the next time I teach a class, it's gone. And the same thing with your videos. I mean, I got tired of, it was almost disingenuous trying to mimic a stroke gait during gait class. And then they have the neuro people later on in the curriculum that would develop it further. But yeah, it was just, and the standardization of this, I knew what I was teaching. I knew what I could ask the students how to prepare and stuff. And so I think that was very helpful in that sense. So.
I actually thought it would be useful just to take a moment for any of the faculty who are still on. Do you have any questions so far about, or even to ask Sarah or myself, any thoughts or comments so far? You can just feel free to unmute yourself if you want to chime in.
I also want to just say that I think it's great for going back and reviewing. So I know that my students go back in there constantly right before practical to go over, how did they do a floor to stand transfer? How was I supposed to do that? So it gives them a resource to be able to go back and refresh, because you spend some time in class, but then you move on and, they forget.
Yeah, absolutely. That's
the other thing that works good post school. I mean, when they're in their fills, they got their little phone. They can look, what's that special test? What's this test? And it's like the old physician's desk reference, that 4-inch thick thing. You don't have to lug that around anymore. I forgot my neuro binder. I thought I was doing an ortho rotation. Now I'm out of state, and I can just boom. I can look it up. I'm familiar with where it's at. Yeah.
Right. Or, you know, for example, our students, they go back into the clinic, whether they're an ortho or neuro, it didn't matter, because they're like, you know what, this patient, geriatric patient with knee pain, I think they're at fall risk. So let me go and do a timed up and go with them real quick. And I have all the tools, how to do it and how to interpret it all at my fingertips. So the ability to integrate the things that they've learned in mass is much better because the resource follows them throughout different semesters and follows them all the way into the clinic. So I think that's also a really powerful value of having this all-in-one resource.
So Mike, I agree. And I will say that when I developed my website, it was because when they graduated and maybe they didn't do neuro for a year or two, and then they had to go back in it. Well, they're like, God, I don't remember. Like they just didn't even know where to go. There was no resource. And so that was originally why I developed it, was not just for my current class, but for people after they graduated.
Yeah, and I remember you mentioning also to me, Sarah, that one of the really awesome things that you have in here as well is, I think, wasn't it the websites?
Yes, so go to evidence-based practice, that last one, and then click that and go to important websites. So that is just a quick link to EBRSR, SCIRES, all the neurological evidence-based websites. There's a wonderful wheelchair one. I mean, so it's just a lot of different ones.
Right.
So if you go back one, go to stroke evidence-based practice, that second one. And that goes right to EBRSR, which if you're doing neuro rehab, you know this resource, but these guidelines are just amazing. It's an amazing resource. So it's just to get them at one quick place to go get to all of the things they need.
That's perfect.
I have a question.
Yes.
Sarah, hi, Elaine Wilder. I'm in Oregon. I love what you've done. This is great. My question, I teach in pediatric and adult neuro. Do you have any cases that are of pediatric clients?
I do not have any pediatric client cases.
I do, Elaine.
There you go.
We're filming them. So we just filmed our first torticollis case, and then we're basically bringing in, we have a hit list, so to speak, of all the common conditions, and we're going to film evaluations and treatments of them, same as what we're doing. So if you look here, we have for neuro. So what are we up to this year? We're filming full evaluations and treatments of patients with common neurologic disorders. And I don't mean just PT, I mean PT, OT, and speech, and physician and social worker. So we're going to try to solve the interprofessional issue as well. But you can see we've made our list. We have different people coming in. We know that we're going to film them. So you saw me sitting in the acute care room. I have upstairs in our studio a apartment. It looks like an apartment. And then in the main studio, we have an outpatient rehab setting. We will film them all, transitioning from acute care to outpatient to home. But by the end of this year, it's going to be pretty amazing. Granted, we've already filmed with Mary, a patient with Parkinson's, a patient with Asia D spinal cord injury, Andrew, who had the traumatic brain injury, and then I think a cerebellar degenerative disorder in a pair of twins. And so we filmed all those. In fact, for those of you who are like, how do I get access to those videos for the full examination? They're done, edited, and filmed. Mary and I need to finish. Usually what we do is we test it out in the classroom first. How is the best way to use that? And then we create the resources to release to faculty. So probably by fall this year, you will have all of those evals ready for you to utilize in the classroom. And beyond that, what you saw with what Sarah's creating and what I'm creating with our team, all of those evals will be turned into asynchronous learning modules where a student walks through different components of the exam. They're asked questions to help develop their clinical reasoning about what they should examine. If I show you this here, so this is us filming in the room. There's our speech therapist doing her thing. And we've turned all of these different things into short little games. So Mary and I said, hey, wouldn't it be cool at the end of balance week for students to be able to go in, here's a patient, Asia D, He's having difficulties with balance. What test should you use? And then as they go through the test, I think this is something like that. We ask them about how do you set up the test? How should the patient begin the test? And then, let me see here, time started. Okay. And then we actually have them go through and do the test. So there's Mary again. This is with John. And we start and stop the timer.
All right, so what you're gonna do is when I say ready, set, go, you're gonna stand up using the walker. You're gonna come around this yellow piece, the blue piece of tape. You're gonna turn around that tape, come back to the chair and take a seat, okay? All right, so ready, set, go.
So the timing of this is important because when the test is over and they know the time, on the next question, we're going to ask them, what was the time that you got? And they're asked to interpret the fall risk. This is probably a 3-minute mini game, but it brings all of those tests and measures into real life application, which I think is such a powerful way to help students really move up the Bloom's taxonomy hierarchy.
So what's the relationship between, Mike, your work and Sarah's work? They're
the same.
They're the same. That's what I wanted to know, because I didn't know I know that she's been working on this amazing stuff and you have too, but I didn't know if they're now.
PhysioU is the platform that MUSC is partnering with so that we can share this with the world.
Okay.
Yeah. So then go ahead.
No, so for the patients with neurological disorders, I assume you've got primary. I know you've got stroke and you've got Parkinson's and MS and
we're going to try to film them all.
Okay.
We're going to try to film them all.
Right.
So let me move back to the PowerPoint real quick just to finish up. Any comments or questions? So you could see here in this little list, neuroanatomy is coming probably by fall. We will be updating neurorehab. Sarah's creating lots of little scripts and a lot of little guides so that faculty can go into the case study section and know exactly what that video should be used for. The task analysis app, we are busy filming. We have 5 people. We will be going to their homes. They're all vaccinated. We are all vaccinated as well. We'll go into their homes and capture them, doing all these common functional movements and tasks that they do in their house, all for our ability to help students do analysis of those tasks. Pediatrics, we're filming, we've got a whole list of interventions that we want to film, basic interventions, PT, OT, and speech, by the way. So we're really exploring the intersection of the rehab team. And it's actually really, really a cool experience. So that's us. And as a sequelae of us filming all these neuro patients, soon in the NeuroExam app, what you will find is that we will add typical and atypical. So when students go and learn about a test, they will be able to click on atypical, and we will just keep adding to the library as we collect videos so they can begin to see what it looks like when when people have different types of neurologic disorders. Right, so this is kind of what I've tasked the team with. It's funny how my baby is orthopedics, but man, we've been having so much fun creating content for neuro and peds. And this is a big area that I think we can really impact for student learning and faculty, to support faculty. So, hey, we made it. That's what I want to show you. This is a moment where faculty can feel free to ask questions. Sarah's still online.
No, she's not.
Thoughts? Oh,
she had to leave.
Okay, yeah. Does anybody have any comments or thoughts? Any questions?
Hi, Mike. This is Heather from Messiah. I've been working on videos of patients with neurological conditions of my own, and it's just really hard to be in the clinic and film and all those things. So I just appreciate, you know, all the video components, because I feel like the students just, they don't
have the context.
Yeah, even if they've been in the clinic, they may not have seen or understand what does ataxia look like, or, you know, so having that visual is just so helpful. And also just hearing how other people integrate it. As a new faculty member, I think it's just really helpful to get other people's ideas and how they use it. So thank you for all the work you guys have done.
Yeah, absolutely. Absolutely. Thank you.
Michael, just James. I think you don't emphasize the work you've done, and I will do that because I've watched you do this. You know, the collaborativeness, and you saw what's going on with Sarah and how PhysioU and the place in, you know, where Sarah's from in South Carolina. I mean, the collaborativeness, and it only becomes of people like you, Heather, that come in and ask and or say, hey, I have these videos, what do you think, and stuff. So those suggestions are very helpful. And please reach out to Mike and let him know what you need. You know, it's been a long time. You're translating this into different languages. On the chat, Eamon is a gentleman from Syria. He thinks he's the first Syrian program to be involved with PhysioU. So
awesome.
You know, and so it just is expanding to all different corners of this world to improve the you know, physical therapy along this world. And so I really much appreciate what you've done, Mike, but really it's because of all the contributions that all of you folks have also helped given Mike ideas and stuff to do. So
yeah,
I mean, a big collective hug for all of us.
Yeah, and I'm always open for those of you who have ideas, who have things that you've been thinking about or need. This is a big year. I mean, we're filming neurologic interventions, we're filming pediatric interventions, we're filming pediatric evaluations and treatments. We're doing it all because I really believe that students, when they come to learn, that it is very valuable for them to see the big picture so that they can mimic, so that they can kind of see how all these little pieces are connected together. I would love for them to see it first. And then I release the details of all the different examination and treatment techniques over time, because we only have so much time per week to teach. But I think the scaffolding that occurs by giving them these games to play, that give them these examinations that they can follow Mary through, and we can ask them questions along the way. None of this has to be, I mean, a lot of it I don't believe has to be graded. I think sometimes when we tie grading too tightly to learning, it hinders learning. And so I'm very focused on taking a lot of this video content and building them into asynchronous learning tools that students can value, that can go through, experience, and walk with a clinical specialist, see how they think, look at how a full examination and treatment go, and then they're so much more prepared to have a good learning experience with the faculty in the classroom. So I'm really trying hard to fill holes that I know we don't have time to teach. I know we don't have all these times to create, you know, case studies. I'm going to build them as asynchronous simulations, or what we're calling interactive evaluations. Those are all coming. I mean, you saw the videos that we have. I mean, if I were to show you just briefly here, the collection of videos, and it's not just about videos, right? It's really a lot more about the pedagogical intention of the videos that you create. So you have Andrew and all the different things that we had Andrew do. All of these will be turned into games. We already have 10 or 12 mini neuro games. All of these will become tools for you as faculty to help really engage the students, and make us a little bit more COVID proof. Or all of us know how much work it takes to bring patients in for patient day. I still think that's very valuable, but I really believe these little mini games, these little interactive evaluations are very powerful stepping stones to helping students really synthesize and elevate their clinical reasoning. Other comments and thoughts?
Mike, several things. One, is there or will there be a case on a preemie?
Yes, actually, one of the children we filmed already is a preemie. But James, if you don't mind noting that down, we will make a point to.
And I just wondered, if they're, because we start. I mean, there are limits to what we expect from our entry-level students, but they need to at least know what they're talking about, because you've done a beautiful job with all the going through the developmental milestones. But one of the things we always have to emphasize, if you've got a baby born at 23 weeks, you're not in the same ballpark. I mean, developmentally, you
Yes.
can't just say take them at the same point. So, we do some change of age type of things, but I wondered about that. And then, is there, and I'm sorry, I was having computer issues this morning, but anyway,
No
is
problem.
there a list of the types of children, babies or children, the diagnoses that you're going to have? Because I wanted to give you feedback, but I just wanted to know
Yeah.
what.
I think the Peds team has a list. The Peds team is actually in Ohio. That's Jana and her team. I think it's in Iowa, because she teaches at Drake. And they basically have a clinic where they bring in children and they do the full eval and treat on these different kids. So I will make a point to get that list, and I'll be happy to share it so we can get some feedback from you.
Yeah, I mean, that's what I want to know, because then I could tell you, I think it would be great to have a child with.
Yes,
if I had that. And
absolutely.
then another question I'm asked a lot is, and maybe you've already said this, is when students finish school, or even for clinicians, what are the options for them to get PhysioU once they're out and about? They've graduated, or
Yeah, PhysioU, they can. This is just open on the web, meaning they can buy it and continue to subscribe to it. We're building a lot of cool tools that help to make clinical life easier too. And I think of this really as eventually a easy way to update yourself on evidence, because
that's what I'm thinking about. But
yeah,
I mean, we have students all the time. They'll say, "Well, I'm definitely going into ortho," and then their life changes, and then they're doing peds.
Right.
And so they're pulling out the books and trying to review and whatever. But I think it would be great to have this option. That's why I asked that. And so there'll be something, or maybe there already is something like an annual subscription fee, or how does that work?
Right. It is an annual subscription thing.
Okay, great. Okay.
And just for those of you who don't have this yet, all faculty have full access to these apps to teach with. This is my hope to support faculty. So all faculty have full access. If you don't have access yet, please feel free to email me at mike@physiou.com, and I will direct you to the right person. And for students, the price is incredibly reasonable, I think. So at the end of this year, it will be $99 a year. That's $10 a month, less than $10 a month for all of these resources. And that will include a lot of these simulations, all of these new things that we're building, all of this filming that we're paying patients to come in, all of it in hopes that when we do our job better and when the students learn better, the world is taken care of better. And that's a worthy cause. And so any other comments or questions?
Well, you're doing an amazing job.
Oh, thank you.
I wish I'd had that for the last 30 or 40 years I was teaching.
Yeah, absolutely.
Thank
James?
you very much.
Mike, yeah. It goes back with some of Elaine's questions in that. And Amen, if you're still on, you may want to, I may ask you to unmute yourself, because you have a lot of patients with CP, and you're asking about that. I think that's the same question that Elaine was asking about that. But also you work with the UNDP organization. Is that the United Nations? Because you're out in Syria.
I think he's
curious.
had to leave already.
Oh, he had to leave. Okay, bummer.
We can always reach out to him separately.
Yeah, I think it's amazing the different corners of this world that we're able to reach now through the electronic media, and PT is, movement is movement, whether it's in the Western Hemisphere, Eastern Hemisphere, Northern,
That's
Southern,
right.
whatever. Yeah. So.
Well, sometimes too, a VAL is a VAL. I mean, if the child has a developmental challenge, if they have Down syndrome, if they have, I mean, it doesn't matter. I mean, that's the way I approach it. I mean, a child is a child. They come in and you do an evaluation. Certainly at some point, it's interesting to know what the diagnosis is, but many times the diagnosis and what you see are just out there. And CP, I mean, CP is like, you know, I mean, if you've got 100 kids with cerebral palsy, you've got 100 children with different combinations of impairments, and also, but it's certainly good to have examples. For example, a child with hemiplegia, a child with diplegia, a child with quadriplegic involvement, paresis. So, you know, so those are great. And like I have my own little library of just my CDs, and I'm so glad to have yours instead.
Yeah, thank you.
But thank you very much.
Yeah, thank you everybody for taking the time to learn a little bit more. This video will be posted on our website under faculty resources. In the faculty resources, there is a deep dive page. So when you go here under PhysioU.health, if you go under educator faculty resources, there is a deep dive webinar series. This webinar that I just did will be replacing what already exists here for neuro and peds. So you can always invite your colleagues or friends that need to learn a little bit more, want to learn a little bit more. This will be posted, and I think you will also get an invite to the video that we recorded. So, hey, I hope everybody has we're not far from the weekend, has a great rest of the week. And please feel free to reach out if you have ideas, if you have comments. I'm always eager to connect with faculty. So take care, everybody.
Thank you very much.
Yes, take care. Bye, Elaine.
Bye. Bye, guys. Bye, Jim. James.
Bye.